Good evening, everyone, and thank you, Dr. Rohit, for introducing me. Today, we will discuss about urothelial cancer or urinary bladder cancer or transitional cell carcinoma. Next, I will just give you overview of bladder cancer, and which include epidemiology, types of bladder cancer, risk factors, clinical presentation, staging, diagnostic modalities, management modalities, and prognosis. Next. Now we come to epidemiology. The bladder cancer is the 10th most common cancer, accounting for 3% of all cancer cases diagnosed worldwide. And it is the 6th most common in men, accounting for 4.4% of total new cases. Estimated approx 4 lakhs 41,000 new cases of bladder cancer worldwide. And this is the incidence rate per sex among 10 top cancers, and the incidence rate of breast cancer is very high, and followed by lung cancer, colorectal cancer, prostate, stomach cancer, liver cancer, cervix, thyroid, esophagus, and bladder cancer at the 10th position. Next. And this slide showing the incidence of bladder cancer statistics in India as per Globocan 2020, and it's showing the incidence rate and death rates are very high in the bladder cancer. Next. And this is the trend in age adjusted incidence rate of bladder cancer in India and Tata Memorial Hospital. And the incidence rate in males is very high as compared to female for the bladder cancer. Next, the types of bladder cancer. There are mainly 3 types of bladder cancer: transitional carcinoma, squamous cell carcinoma, and adenocarcinoma. The transitional cell carcinoma is the most common cancer for bladder, that accounts for about 90% of all bladder cancers, and followed by squamous cell carcinoma, which accounts for about 4%, and adenocarcinoma, this accounts for about 3% of all bladder cancers. Next. And there are the risk factors associated with the bladder cancers, and smoking is the most important risk factor for development of bladder cancer. Bladder cancer is more than 3 times more common in smokers. And other risk factors are the male, Caucasian race, and age more than 55 years, genetics, personal history, having urothelial cancer, other urothelial cancers, or chronic bladder irritation and other infections, and exposure to certain chemicals like benzidine, beta nephthalamine, certain medicines like pioglitazone, the prior history of chemotherapy or radiotherapy, and low fluid intake. Some herbal supplements containing aristolochic acid are also risk factor for the development of bladder cancer. Next. Some occupations are at high risk for development of bladder cancers because they are using aromatic compounds, and these occupations are dry cleaners, painters, auto workers, truck drivers, paper manufacturers, metal workers, plumbers, hairdressers, tire and rubber workers, chemical workers, and petroleum workers. Next. This table is showing the sign and symptoms of the bladder cancers. The hematuria is the most common symptom of bladder cancer, and hematuria may be gross hematuria or maybe microscopic. And patient may have some irritative symptoms like dysuria, frequency, nocturia, urge incontinence or urgency. Patient may present with complaints obstructive symptoms like decreased force of stream, feeling of incomplete voiding, intermittent stream or straining. Patient may have some signs and symptoms of metastasis or advanced disease like abdominal pain, pelvic pain, and patient may have some constitutional symptoms like anorexia, weight loss, or others. Next, staging of bladder cancer. Uh, we call stage 1 when the tumor confined to the internal lining of the bladder. In stage 2, the cancer has spread to the muscle wall of the bladder. Stage 3, the cancer has already grown to the fatty tissue outside the bladder vessel. And in stage 4, the cancer has metastasized from the bladder to the lymph node or other organs or bones. Next. We can divide bladder tumors in on the basis of invaginous, the non-muscle invasive cancers. The tumor is confined to the superficial layer of the cells are non-muscle invasive cancers. If the cancers have grown to the deeper layer of bladder wall, uh, are also known as muscle invasive cancers or stage 2 or and 3, and these are treated by surgery or radiation with the chemotherapy. And the metastatic bladder cancer or stage 4 cancers have metastasized to distant organs, and they are very difficult to treat or cure. Next. The diagnostic modalities, after taking medical history and physical examination, we can go for urine for urinary tumor markers. And the other modality is cystoscopy, which is invasive. We can detect growth in the bladder and determine the need for biopsy or surgery by TURBT, transurethral resection of bladder tumor. Next. TURBT, a transurethral resection of bladder tumor or transurethral resection, is used for diagnosis and staging as well as treatment. Next. Other diagnostic modalities are imaging, imaging of pelvic and abdominal region. These are renal ultrasound, IVP, retrograde pyelogram, CT scan, MRI, PET scan, or CT MRI urogram. A CT urogram is a test using a CT scan and a special dye to look at the urinary system, including detection of the bladder tumor. Next. Management and treatment. Actually, this part will be discussed in detail by Dr. Rohit Swami in next session. I will give you just a brief basic idea. The surgical management. The transurethral resection of the bladder tumor, TURBT, is used most often for early stage of disease. The partial cystectomy, the removal of some part of bladder, is used for a single tumor that invade the bladder wall in only one region. A radical cystectomy, the used for more extensive cancer or in advanced disease. Next. Chemotherapy. Chemotherapy may be given by two routes: intravesical chemotherapy or systemic routes. Sorry, एक मिनट. हेलो. हाँ, एक मिनट मैं अभी अभी के बारे में बात करूँ. मैं एक जो मिनट में. ओके. Intravesical chemotherapy include mitomycin, C. Gemcitabine, docetaxel, and valrubicin. And if you talk about systemic chemotherapy, the most common regime for systemic chemotherapy is given in the advanced stage, and it include the cisplatin, carboplatin, gemcitabine, docetaxel, paclitaxel, or pemetrexed. Next, immunotherapy. It is novel therapy, and it uses the body's natural defense to fight against the cancer. It includes BCG or interferon, and it can be given also in by systemic route. Uh, it includes atezolizumab, avelumab, nivolumab, or pembrolizumab. Next, targeted therapy. Targeted therapy is a treatment that targets the cancer-specific genes, protein that contributes to cancer growth and survival include. And these targeted therapy include idafitinib, enfortumab, vedotin, and sacituzumab govitecan. Next, the other modalities of treatment, radiation therapy. The radiation therapy is the use of high energy X-ray to destroy cancer cells, and radiation therapy is usually not used by itself as a primary treatment, but it is typically given in combination with the systemic chemotherapy. Combined radiation therapy and chemotherapy may be used in bladder cancer that is located only in the bladder. And prognosis of bladder cancer depends on the stage at the diagnosis. The 5-year relative survival rate in the carcinoma in situ is 95.8%. And if the tumor confined to the primary site, this rate is 6.9.5. If the tumor is spread to the regional lymph nodes, the 5-year relative survival rate uh, is 36.3, and in metastasized or distant tumor, it comes to only 4.6%. Next, okay, this is from my side, and the advancement of treatment in the bladder cancer will be discussed by Dr. Rohit Swami in further session. And over to Dr. Rohit.
Thank you, Dr. Mukesh, for a lovely session covering all epidemiology as well as treatment part, diagnosis, as well as prognosis of the bladder cancer.